Hi, my name is Erica Carrasco, and I live with the following pain conditions: hemiplegic migraine that mimics stroke, migraine with brainstem aura, vestibular migraine, daily persistent headache, and with all of that, I also have symptoms of dystonia and also allodynia. And allodynia is kind of like when something lightly brushes against your skin and it's extremely painful. That's basically what that is. I also live with non-epileptic seizure, osteopenia, degenerative disc disease, mixed connectivity tissue disease, and several others that cause pain. And with that, finding a therapist to help with my mental health is really, really difficult. But it doesn't have to be, you just have to know what to do. And had I known this beforehand, I would have been golden. I went to each website where I knew my either insurance or I knew I could get good rates. And I looked at the bio of each person and I made sure that they had experience with chronic pain or chronic illness or something in that general arena. If they didn't, I just moved on to the next person. I went through 3 therapists before I found the one that I use today, and she's amazing. She actually has migraine herself, so she understands. And I think that that's really what's key, is to find someone who maybe does have a chronic illness or a chronic pain condition, or who has a family member that they care for that do. It's gonna take time, but it's a lot like dating. You're gonna cycle through a few before you find the right one, the one. So hopefully you find that person. Keep trying, it's worth it, I promise, because living with these pain conditions is not easy. It's hard and it's a struggle, but we can do it.
Hi, my name is G Garza, and chronic pain for me comes from complications with medications with AIDS, also from chemo from anal cancer. And the way that it affects me mentally is that there are days when I wake up and my pain level would be a 2, other days it would be a 5. And the stress and anxiety that comes with not knowing if I would be able to accomplish everything that's on my goal list for the day. This can be hard when you're trying to launch your own business, meet with people, or simply have a Zoom call at times. So my mental health is affected by my chronic pain because I don't know at what level my pain will be for the day. I'm G Garza, and this is my chronic pain.
Hi, my name is Emmitt Henderson III. 25 years ago, I was diagnosed with systemic lupus. I also was diagnosed having discoid lupus, lupus nephritis, Sjogren's syndrome. I am a patient of 2 transplants, the kidneys and stem cells. I have vascular necrosis, which led to 2 joint replacements. I have encephalopathy of the brain and a host of other ailments. I cope with mental health barriers while living with chronic pain by just taking a proactive approach to my physical health and my mental well-being. This is how I got through all these years. I know the odds are against me every day when it comes to pain, but I surround myself with positivity. I read literature that stimulates my mind, and most of all, I love myself too much to not let this illness take me out without a fight. Doing this, my pain is almost non-existent. Keeping my mentality strong helps my body become strong. Therefore, that makes my pain minimal.
Hi, my name is Rodney Reese, and I'm from Baton Rouge, Louisiana. I was diagnosed with sarcoidosis, both pulmonary and sinus, in the year 2000. I am the founder and CEO of the Sarcoidosis Awareness Foundation of Louisiana, Incorporated, and the Sarcoidosis Awareness Support Group of Greater Baton Rouge. I'm also a patient ambassador for the Foundation for Sarcoidosis Research and a moderator for the National Online Sarcoidosis Support Group. Today I'm here to speak with you about chronic pain associated with mental health. Chronic pain is often associated with anxiety and depression, which can both cause a low health-related quality of life. Chronic stress is also known to change the levels of stress hormones and neurochemicals found in the brain and the nervous system, thereby causing a chemical imbalance that may trigger depression and anxiety. Excuse me. People who suffer from these illnesses may find it difficult to participate in social activities and hobbies, and this can lead to a decreased self-esteem. It is also common for people with chronic pain to have sleep disorders, fatigue, mood swings, decreased appetite, and trouble concentrating. These negative changes can exacerbate one's pain and worsen their overall mood. Now, I am not a doctor, and I repeat, I do not give medical advice, but I can tell you what I know and what I've learned. Living with daily pain is physically and emotionally stressful, and believe me, I know. However, one thing that has kept me sane is positivity. Every day that I wake up is a good day, no matter how I feel, and I know that each day is going to be better than the last.
My name is Kristal Kent, and I live with several chronic pain medical conditions, fibromyalgia, osteoarthritis, migraines induced from spinal cord compression, degenerative disc disease, IBS, and peripheral neuropathy. Some of the ways that I cope with my overall emotional well-being and mental health while living in chronic pain is reaching out to my community members on social media or social platforms just to have that connection with people who understand what I'm contending with because they live it themselves. In light of 2020 and COVID, the boom of virtual telehealth appointments has been a really great tool to push through barriers living in chronic pain to outreach and connect with medical and mental health providers. And finally, sometimes there are days where you just can't get out of bed because I'm in a flare or my chronic pain is so bad. And a lot of times on those days, I occupy my time and push through barriers with watching like movies I find to be funny, or music that I love to listen to, or simply connecting with people on social media. And those are a few of my tools that I use to push through mental health barriers while living